Welcome to Avoiding the Literature Landslide, Part 2b, Choosing the Right Resources for Your Question. Our objectives in this module are to identify Brown University Library resources that can help answer your foreground questions and to use some of the key features in Dynamed Plus, the TRIP database, and some special features in Pubmed. In the previous module, we focused on background questions and some of the resources that could be used to answer them. This module will focus on foreground questions. A foreground question asks a specific question about managing a patient or population. For example, you might be comparing best treatment options or the most accurate diagnostic tests. This information can be found in clinical summaries, systematic reviews, practice guidelines, or original research studies such as randomized control trials or cohort studies. We'll walk through the point-of-care resource, Dynamed Plus. We'll then look at the TRIP database and Pubmed using the systematic review filter. And finally, we'll look at quick ways to get experimental studies in Pubmed. Again, we're going to use the clinical resources page today. We'll start with Dynamed Plus. Like most of our other resources, Dynamed allows you to create an account that you can use to log in directly to the resource rather than going through the library website each time. You can also download the Dynamed app and renew it twice a year. There's an extensive list of calculators within Dynamed, sorted by various criteria, or just searched alphabetically. And note that Dynamed features an easy way to check for topic updates, including practice-changing updates. We'll click on View All here. And let's look at internal medicine. These are all of the recent updates to the internal medicine categories, but we'll look at practice-changing updates. So you can quickly see there have been some recent updates to the aspirin for primary prevention of cardiovascular disease article, cutaneous squamous cell carcinoma, HRT, and many more as we go down the list. I can subscribe to recent updates in my topic of interest just by selecting the topic area, then going to follow and entering my email address. To do a point of care search, we'll just use the search bar. We'll do our search for acute bronchitis. Note that just searching for my terms will pull up the terms in a couple of ways. I have the option to go to the article on acute bronchitis, or at the bottom I can search for acute bronchitis, which will search for my terms anywhere in any article. We're going to go to the acute bronchitis article. Each article starts with the overview and recommendations. This gives you a brief summary so that you can quickly read the article if you are at a patient's bedside. So there's background, there's evaluation, and then there's management. It tells you how strong the recommendations are. Under adults, we see that it says do not use antibiotics. If I click this, it brings me further down into the article to the treatment options and gives me more details on the recommendation and where the recommendation comes from. This is an infectious disease. So in this case, our recommendations come from the ACP and CDC. You might see recommendations coming from another professional organization depending on the topic of the article. Now, if I were to just do a quick phrase search for acute bronchitis without specifically looking for the topic article, we'll run that search again. Now it's giving me a number of options. It gives me that topic article for acute bronchitis that we already looked at. It also shows me any images that are pulled up that might have acute bronchitis tagged on them somehow. And it might give you some calculators and some drug information. In this case, in addition to specific drug information, there's also an article on rational antibiotic use in the outpatient setting. So we can go to this to get another general article on antibiotic use for common infectious diseases. That's the quick overview of Dynamed Plus. I encourage you to dig in a little deeper and explore some of the resources. I encourage you to dig in a little deeper and explore some of the other features of this resource. We've gone back to our clinical resources page. And now we're going to go to the TRIP database. TRIP is actually a free resource. TRIP stands for Turning Research into Practice. It was an attempt to compile evidence-based literature into one place for busy doctors who may not have access to a lot of subscription databases. I particularly like to use TRIP to find clinical guidelines from many different countries and organizations. And here we have guidelines from a number of different countries. So we'll go to the USA. And I see several different guidelines here. I'm going to go to the one from ACP, appropriate antibiotic use for acute respiratory tract infection, etc. And in this case, it pulls up the free articles from Annals of Internal Medicine. TRIP does try to link out to free articles, so most of what is in here should be accessible to just about anybody that you work with, without having to go through Brown's subscription resources. You can see, in addition to guidelines, TRIP breaks things down by systematic reviews, evidence-based synopses, and different kinds of primary research. Finally, let's go to Pubmed. I always use the link to Pubmed that's provided by the Brown University Library so that I can see all of the full text options that we provide through our Find It icon. You can always bookmark this link. Just make sure that the link you're bookmarking has this myNCBI share equals Brown U. I'll give more information on why this is important in our third module on how to find full text. I'm going to do a very basic search in Pubmed. I'm going to look for antibiotics or amoxicillin and acute bronchitis. $2,000 articles is a lot to go through, so I'm going to narrow by systematic reviews. If you use Brown University's link for Pubmed, you'll see a systematic review filter over here on the right. If for some reason you don't see this link on the right, over on the left are generic filters that should appear no matter how you get to Pubmed. And under article types, we can go to systematic reviews and narrow down. This does narrow to 150 systematic reviews from many different journals. And here I should warn you that not all systematic reviews are created equal. Different journals have different quality standards for what might be considered a systematic review. However, if you see something from the Cochrane database of systematic reviews, in general, that's a reliable source. And I see antibiotics for acute bronchitis. And here's the abstract of this article with the author's conclusion that there is limited evidence of clinical benefit to support use of antibiotics in acute bronchitis. For the full text of the article, if you're sitting on campus, you can always try the publisher-provided link. And if you're sitting on campus and this is how we subscribe to the journal, the link should work. And here's the full text of this particular Cochrane review. You might sometimes be doing research on topics where there are no clinical summaries and there are no systematic reviews, and you might need to go into the literature and look for primary studies such as randomized control trials. Pubmed does offer some filters to let you quickly get to to the experimental study content. I'm going to go back to the Pubmed homepage, and I'm going to click on Clinical Queries. Clinical Queries offers filters that let you narrow your search by particular study types. Again, I'm going to run my search for antibiotics or amoxicillin and acute bronchitis. If I were trying to be very, very comprehensive, this might not be the way I would do a search. But this is a good way to get articles when you just need to see what's out there. So I run my search. Now, Clinical Queries allows you to narrow your search by different topics. So under the category Therapy, I click and I see that I could narrow my search. Instead of therapy, I could use diagnosis, etiology, prognosis, or clinical prediction guides. I'm going to stick with therapy. For broad, this is a very sensitive search designed to pull up most relevant trials. A narrow search will filter your search to just look for randomized controlled trials, which is still a hefty number of studies. Clinical Queries also allows you to filter by systematic reviews. This is the same filter that's found on the main page. And it also offers a medical genetics filter. This, of course, is not relevant for the search that we're doing, but if you are looking for ways to do medical genetics searches, there are some good ways to narrow using the Clinical Queries tool. All right, going back to our clinical studies category, therapy, narrow, it tells us 349 results. Of course, it's only showing us the first 5 or so, so I'm going to click on See All. Here it tells me that I only have 7, and that is because I left my systematic review filter on. So we will clear that to see everything. That is 349 results is still quite a few. If you've used Brown's filter, you can narrow by core clinical journals. And that's the top of the journals such as New England Journal of Medicine, Lancet, BMJ, Annals of Internal Medicine. Brown is going to have probably 95 to 99% of these journals. If you run through the articles and find, if you run through the references and find an article that you would like, once you start paging through these references, you might find an article that you would like to read. So as with the systematic review filter, all you need to do is click on the title. There are lots of full text links over here. We'll go into some of these into the next module, but again, always try the publisher supplied full text article, full text link. And if Brown has it through the publisher, that link should work for you. That concludes the module on foreground questions. The next module will look at article databases, full text journal access, and how to get articles when Brown does not have the full text of them. Thank you.